Why TMS, guys?
Crazy effective.
Crazy effective, especially starting about 5 years ago. I've referred to TMS, not been a TMS practitioner for like 25 years.
Mm-hmm.
It put out in 1985. It's interesting because the engineer who created it actually just gave it away. Had no patents, poor guy. So he made no money. He made billions.
The science is always 15 years or so ahead of the practice.
Mm-hmm.
But by him doing that, it shortened that.
It helps humanity. I think.
It should.
Yeah.
It did.
Yeah.
So why TMS? I mean, TMS was always reasonably effective for depression. That's what everybody knows.
That's right.
But it still wasn't really much better than antidepressants for remission rates until 5 years ago. Stanford came out with an accelerated protocol. It's called the SAINT protocol. And they were getting remission rates in the 90 plus.
I'm sorry.
Stanford came out with
For what rates?
as in getting completely better remission rate.
The remission rate. So someone's not depressed anymore?
It means they have no depressive symptoms. That's right.
Really?
Yeah. They go into remission often in 2 to 3 days.
Always was effective at a reasonable remission rate up until 2020. And it was always non-invasive, no side effects, basically no risk. So if people were failing traditional treatment, therapy, or meds, I would refer to it. In fact, that insurance won't cover it unless it used to be 4 meds, now it's 2. So it has improved.
That's right.
Yeah. And it only covers.
It is the big limitation of insurance.
It's a limitation,
Yeah.
Because they don't want to have to pay for it right away.
Even if they don't want to have to pay for it, what's the most effective? And that's the biggest thing we run into.
Yes. So the most effective are these accelerated treatments where you can get somebody better. Potentially now there's a 1-day treatment. It's amazing. We do 1 day, 5 days, or 10 days. So in 2020, these protocols came out that were super powerful, and they actually got FDA approved in 2022. That's when I started getting very excited and very interested. And that's between that and a personal story I have, that's why I got into it. But it doesn't just apply to depression. It applies to 20 psychiatric disorders. The FDA has actually approved 6.
Give me that.
And those are OCD,
Anxious depression,
anxiety, basically, depression, adolescent depression, migraine, pain,
chronic
nicotine dependence. Yeah. But it actually spreads to all addiction. There are studies now on many, many different substances. And as you know, there are no real medical treatments for many substances of abuse.
Tell me about that. How does TMS assist in addiction treatment?
It's just the basic protocols. There's different kinds of, if you talk about alcohol abuse, there's different reasons people drink. Some people drink to avoid withdrawal symptoms. Some people drink due to underlying anxiety or other things. Some people use it for reinforcement, and those are actually different brain networks. And it's still in development. But if you target those different brain networks, you can really you have the potential to focus on the reason for the addiction.